leg projections come off of these ribs coming through here, and they come up, so they're going to end up pulling it downward as well. Then levator scap pulls up, lower traps pulls down. So if every action, there's an opposite reaction for the muscles trying to stabilize. Then lateral medial rotation, trapezius upper and lower, they actually kind of compete against each other, but the levator scap will pull up as well. Serratus anterior and the pec minor kind of compete as well. So, how do we move the glenohumeral joint? Deltoid muscle. Deltoid has three parts: anterior, middle, and posterior. Deltoid predominantly comes off the clavicle for the anterior component here, and the middle and posterior is coming off mostly off the spine of the scapula, off the acromion process. There and there. So it kind of wraps around that area. It inserts into a bony landmark called the deltoid tuberosity. Tricky. Primary action is abduction, but it also, in this motion, has leverage to do flexion extension. He's adding photos as we speak. Deltoid tuberosity is this landmark that's right in there. And on palpation, we'll go through there. They all come into a single point in that spot. So if I hide them out of the way, pec major, fan muscle here, broad, comes into more of a point here, pulls the arms forward. So when it's abducted, it has forward flexion. It also, in this position here, has this very strong pull of internal rotation. So which three muscles gave us predominant external rotation? Which muscles give us external rotation?
Pectoralis major? Minor?
No.
Wait, rotation?
Rotation, which gives us external rotation.
External? Trap?
Three of the six.
First three.
Supraspinatus, infraspinatus, teres minor, the three that go to the greater tubercle. Those three do external rotation. Subscap comes from the anterior portion of the scapula forward onto the lesser tubercle, which helps pull it down and in. So we only have one for internal rotation because we also have the pec major, which is a very, very strong muscle, coming across that helps have internal rotation as well. You are much, much stronger on internal rotation because it was the pec than you are with the three muscles doing external rotation. So pec major, right there, very broad muscle. We make you go away. Biceps brachialis, we have two, long and a short head. Long head originates on the supraglenoid tubercle, short head originates on the coracoid process. We can kick them out of the way. Opposing that, we have the triceps, meaning we have three heads. Long head, if the long head of the biceps is off the supraglenoid, long head of the triceps is off the infraglenoid. What is the action of the biceps brachii primarily? Elbow flexion. Now, because the long head originates above the supraglenoid tubercle, it also has leverage to do forward flexion. But yes, actually the short head will do that too because it's on the coracoid process. It's on the scapula as well. So both of them are going to have forward flexion. Triceps, the long head, is on the scapula, on the infraglenoid tubercle, which means it's going to have action at the shoulder as well. The other two, the medial and the lateral heads, are coming off of the humerus itself, which means that they are primarily elbow extension. There's no way they have leverage to do any work on the shoulder, on the long head in place, it does have impact. Now beyond that, we have three more muscles that we're going to focus on. We've already talked about coracobrachialis, which is right here, coracoid process to the humerus mid-shaft. Kick him out of the way, and that leaves us two muscles. Teres major, which I mentioned mistakenly earlier, apologize, sneaks up, it's off the inferior angle of the scapula, and it acts on the humerus to abduct, to pull down. So pulling back in towards the bottom and adduction, adduction pulling in. The other one is this very massive set of muscle right here, which is your latissimus dorsi. Lat pull downs, pull ups, those exercises coming here and pulling down, very strong adductor. There and there. So it's not a nightmare. Group them. We have scapular stabilizers. There's 6. You have a rotator cuff. There's 4. And then for glenohumeral motion, we have biceps, triceps, coracobrachialis, pec major, pec minor. Sorry, pec major. Pec major. And deltoid. Yes? Yes. Oh, and teres major. All right. So, for glenohumeral motion, biceps, triceps, pec major, deltoid, coracobrachialis, latissimus dorsi, teres major. 7. So a list of 4, a list of 6, a list of 7. Grouped by what their primary functions are. Joints that we have so far: sternoclavicular. We have a superior and inferior portion of the supraclavicular ligaments. We also have an interclavicular where it goes from clavicle to clavicle across the manubrium. We have the acromioclavicular joint, which has a acromioclavicular ligament, but that doesn't do a whole lot. What we have is the coracoclavicular ligaments, the bands underneath, which tether it and stabilize the whole thing's down, running from here to here. Those right there and there, giving you primary support. Underneath, to finish off the arch between the coracoid process and the acromion, we have the coracoacromial ligament right here, which finishes off the ceiling to stabilize the glenohumeral joint. Now, the glenohumeral joint is the humeral head into the glenoid, which is surrounded by the joint capsule, and you have a superior, middle, and inferior portion of those bands that help stabilize that, which is just thickenings of that joint capsule. Under this archway, under the arch that runs right up and through here, you have the supraspinatus muscle, which goes straight through. You have long head of biceps tendon, which inserts into that greater tubercle, the superior glenoid tubercle right here at the top. The inferior glenoid tubercle is down here, which is long head of triceps. And then the bursa that goes with it, subacromial bursa. One last very unique component when you're looking at motions is that in this position, the plane of the scapula, supraspinatus coming across the top doesn't have any direct pull for external rotation. So it just kind of sits on top. Its primary action here is it works the first 15 degrees of abduction in this plane of the scapula. So it's going to start the motion of pulling out. After that, the deltoids are going to kick in and take over because they're much bigger and much stronger. So it's less of a rotator, more of an abductor here. But once you get internally rotated, it will start having a pull to pull back. Supraspinatus becomes very involved in terms of throwing mechanics as both a stabilizer of the humeral